In today's video, we are going over an evidence-based guide to lateral ankle sprains, prevalence, clinical presentation, and risk factors. Let's go. So what's the problem with lateral ankle sprains? So lateral ankle sprains are very, very common. Depending on the study that you look at, it is the number one injury in sports. Okay. Again, that's going to vary based on the population. It's very scary when it occurs. It's one of the major reasons why folks go to the emergency room. Symptoms typically resolve pretty quickly after you have a lateral ankle sprain, and largely that's a good thing. But the problem is that up to 50% of folks after they have a first lateral ankle sprain will have recurrences. So they tend to occur again in the future, or they're left with some sort of long-standing instability, pain, swelling. We'll talk about this a little bit later, but something known as chronic ankle instability, which is another big problem. Largely, it's not taken very seriously as an injury, despite a lot of folks going to the emergency room. A big chunk of folks that do end up with a lateral ankle sprain, they don't end up seeking medical attention. Another huge problem with lateral ankle sprains is misinformation. So let's say you sprain your ankle and you go to Dr. Google, and you type in lateral ankle sprain or lateral ankle sprain treatment. You'll have a bunch of information pop up. These were the first three articles that popped up when I Googled lateral ankle sprain treatments. And largely it looks like they're reputable sources. So one is from the Mayo Clinic, one is from UConn, so major university there. The third is just rehabaccess.com. No idea what that source is. But largely, they give information out about using RICE, rest, ice, compression, elevation. And they also largely talk about not ambulating for up to 2 weeks after you have a lateral ankle sprain. That information is just wrong. Okay. So we'll talk about what the evidence says a little bit later about RICE and also about ambulating or walking after you have a lateral ankle sprain. But suffice to say, this information is just wrong. And the sources look reputable. They look pretty good, right? And it's the first few sources that pop up after you go on Google. Now, this is a huge problem because we'll see in a bit, having ankle sprain is a serious issue and it's a big burden on our society from a healthcare cost expense. And largely, if you go on Google and try to find the answer, right, be informed consumer information after you have an injury, you're not going to get good information. It's bad. So that's a big problem. So in today's episode, we have an evidence-based guide to lateral ankle sprains. We're going to be going over the prevalence of these injuries. We're going to go over history and clinical presentation of lateral ankle sprains. We're going to go over prognosis and natural history. So how long do these things tend to get better? What happens to them over the course of time? What are predisposing factors to the injury? What are your risk factors? What is the mechanism of injury? What is the anatomy of a lateral ankle sprain? What is the diagnosis as well as differential diagnosis? What else might be going on at the ankle if you roll it or twist it? What are the best treatments for lateral ankle sprains? How do we return to work or return to sport? And lastly, how do we prevent future injuries? Before we get started, I just want to give you a big thank you for your support. You truly allow me to do what I love for a living. My name is Dan Pope. I'm a physical therapist. I'm a coach, personal trainer, and meathead. This is the Fitness Pain Free Show, where we help coaches and physical therapists like you get your patients out of pain and back to training. If you're watching this on YouTube, hit that like button, comment, and subscribe to the channel. And if you're listening to the podcast version of this, please give me a positive rating and review. Helps me out tremendously. I've also created an evidence-based guide to ankle sprain injuries cheat sheet. It's a handout that goes along with today's lesson. We go over all the basic points I just went over: prevalence, history, prognosis, predisposing factors, mechanisms of injury, anatomy, diagnosis, differential diagnosis, treatments, return to sport and work, and injury prevention. I'll leave a link in the show notes, 100% free. You can go ahead and download that. Again, it's a companion for what we're going to go over today. It's also a really nice reference sheet that you can go back on a little bit later in the future. If you kind of forget what I went over, you want a quick refresher, it's all going to be there. So the majority of the information we're going over today is from one article. It's from the British Journal of Sports Medicine. I'll leave a link in the show notes so you guys can definitely check that out if you're interested. It's called Diagnosis, Treatment, and Prevention of Ankle Sprains, Update of an Evidence-Based Clinical Guideline. So this was a great paper. It's a little bit older. It's 2018, right? But when I was doing my deep dive, my literature review, and trying to figure out the best papers to include in this presentation today, this was by far the best. So if there's some more information after 2018, I actually included that, and I'll put all of my references in the show notes, but largely the majority of the information today is actually coming from this article. So what's all this hubbub about lateral ankle sprains? Well, it's the most common lower extremity injury, especially in physically active individuals. There are around 2 million sprains treated in the emergency room annually in the US and UK combined. In sport, it constitutes somewhere between 16 and 40% of all injuries, right? That's a wild number. The reason why there's so much variety is because it really depends on the sport mostly. In the US, lateral ankle sprains have the highest recurrence rate of any injury. Now, this is amazing because we know that if you had a prior injury, it's going to predispose you to a future injury, oftentimes in the same area. That's certainly true for lateral ankle sprains and has the highest recurrence rate of any injury. Okay. And that's a big problem. And we'll talk about why this is an issue that's important, largely, spoiler alert, because we can actually help folks, okay, and reduce that recurrence rate. So up to 40% of people, 47% of people with a lateral ankle sprain go on to have chronic pain or recurrences. Okay. And that's a big problem because largely lateral ankle sprains are not treated like a serious problem, although they end up being a serious problem for most folks. This next quote is from Wagemans et al. In 2022. Many of the practitioners treating these injuries, lateral ankle sprains, have a moderate understanding of their epidemiology and often limit management to rest, ice, compression, elevation. Now, I just said that's what Google says, so obviously this is misinformation. Furthermore, the public perception that ankle sprains are innocuous remains widespread and is estimated that less than 50% of individuals who incur an ankle sprain consult a medical professional, right? Now, one of the reasons why this is a big problem is because rehab, good physical therapy rehab, reduces the risk of recurrent ankle sprains by 40% compared to usual care or doing nothing. So the information that's available right now on Google is just straight wrong. And it also appears that medical providers don't know this. And this is a big problem. Hence the reason why we're going over this guide today. Here's another big issue. Despite being the most commonly incurred sports injury with a high recurrence rate, we just said around 50%, there are no guidelines to inform return to sport decisions following acute lateral ankle sprains. So, what that means is folks get an ankle sprain injury and they return back to their sport. And there's no testing to see if you're ready to go back to sport. Okay. And we actually do have a decent bit of guidance we'll talk about a little bit later. But largely, most folks are not going through this process before they return to sport. So, more than half of individuals who sustain a lateral ankle sprain injury do not seek formal medical treatment, and many return to sport before injury associated impairments are resolved. In fact, 71 to 75% of U.S. high school athletes were sanctioned to return to sport within 3 days of incurring acute lateral ankle sprain, with 95% sanctioned to return to sport within 10 days of injury. This stat is wild to me, right? So essentially, half of all folks that get a lateral ankle sprain that are athletes return to sport within 1 day. The large majority get back within 10 days. Okay. We also know that those recurrence rates are quite high. I'll tell you, I've had a bunch of lateral ankle sprains in my youth, right? I can't tell you how many times I kind of twisted or rolled my ankle and just got right back to activity and didn't think about it. Didn't even tell my coach, just kind of went back to training, right? And I think that's largely what happens for most folks. They don't take it seriously. And since symptoms resolve relatively quickly, we're like, all right, we're good. No problem. Let's just keep moving on. It's just that the recurrence rates are quite high. And the other problem with that is that nobody wants chronic pain or recurrences, but also can increase the rate of osteoarthritis over the course of time. That's not good either. Okay. So, when exposing athletes with recurrent sprains to proprioceptive training, the risk of recurrence of a lateral ankle sprain is reduced to the same level as healthy controls. Now, this stat is wild to me, right? So, largely, you have all these folks getting lateral ankle sprains, okay? 50% of them, literally half of those folks, are ending up with chronic pain. And you've exposed those folks to a really good physical therapy program with proprioceptive training, their risk of lateral ankle sprains goes right down to the level of what it was before you had an injury. And that's absolutely remarkable. Okay. And yeah, that's going to be a little bit of what we talk about today, but largely we should probably be telling these folks to do some sort of rehab program, not rushing them back to sports so quickly. Lateral ankle sprains also have a large societal burden. What do I mean by that? So largely, it costs the healthcare system money every time someone sprains their ankle, right? Estimated societal costs per injury, at least in the UK, are somewhere between 360 to 1,100 euros per injury. So 2 million patients annually are hurt with a lateral ankle sprain in the UK, the United States, If you do some math, €1,000 times, let's say, 1 million patients, that's a lot of money for the government to hand out to try to handle these lateral ankle sprains. The other piece is they lead to a lot of lost work time. Let's say you sprain your ankle, you go on Google, Google tells you not to walk for 2 weeks, you're not going to work. Okay. You're going to sit on your butt all day long, get more sedentary, right? Lose time from work, be more expensive. The other piece we know is that people lose sport time. And this is a problem because we want people to be healthy. It also causes folks to be sedentary. Let's say you take an active person who's less cost to the government, make them sedentary because they had an ankle sprain injury, and all of a sudden they become less healthy and it causes long-term problems. So what's the prevalence of lateral ankle sprains? Well, it's high. 40% of all lateral ankle sprains are from athletics. So largely it's a sports injury, although there's a lot of folks that get their ankle rolled and it's not from a sport, right? And the average amount of lateral ankle sprains is 7 per every 1,000 hours of participation. And this is coming from indoor sports where the large majority of lateral ankle sprains occur, right? So if you're playing a sport that's not indoor and it doesn't have a high risk of lateral ankle sprains, your number is not going to be quite as high. But in these indoor sports, it is actually quite high. And like I said previously, only 50% of these folks are going to seek medical attention. And then up to 50% end up with recurrences or chronic ankle instability. So guys, if you like what you're learning about so far, then I want you to go and check out the Fitness Pain-Free Mini Course. So I made a mini course. It's absolutely free. That's the next logical step if you want to learn more from me. So in the course, we go over 5 lessons. That first lesson is how traditional schooling has failed us, right? So schooling is phenomenal from a physical therapy perspective, but doesn't really teach you how to work with high-level athletes in the fitness world, right? Doesn't always teach you how to do the lifts appropriately. Doesn't teach you about progressions and regressions of common lifts within the gym. Doesn't teach you how to program normally, how to write rehab programs, or how to write injury prevention programs for these folks. Next thing we go over, 7 reasons why people get hurt in the gym, 4 simple steps to getting your clients out of pain, how to build the career of your dreams and earn the respect of your community. It's all well and good if you know exactly how to work with folks within the gym. But if you can't get these folks through the door on a regular basis, then you're simply not going to be living the dream that you want to because you can't get the patients through the door that you want to work with. Okay, so I'll show you how to do that. And lastly, we'll talk a little bit about the Fitness Pain-Free certification, right? So I'll leave a link in the show notes. I definitely recommend checking this out. Once you sign up for the Fitness Pain-Free Mini Course, you will be automatically placed in the waitlist for the Fitness Pain-Free certification. Now, the Fitness Pain-Free certification is the course, the certification that I wish I had as a new grad that fills in all the gaps in knowledge that you don't get in physical therapy school. So A, you'll gain complete confidence working with injuries in the strength and fitness world. You'll learn optimal technique for both health and performance from myself and some of the best coaches in the world. You'll master programming for rehabilitation and injury prevention. Have fun while earning a whole bunch of physical therapy and physical therapy assistant credits. You have 31.5 of those. You'll also gain NSCA credits as well as CrossFit credits if you need those. This is the equivalent of a university education in working with injuries in the weight room. I really believe that. I've been adding to this thing over the past 5 or 6 years. It's massive, a ton of phenomenal information. And lastly, the biggest goal is just to fill your day with the patients you love working with and building the respect and admiration of the communities you love working with. So I'll leave a link in the show notes. Sign up for the Fitness Pain-Free Mini Course. The certification is open 4 times per year for 1 week to enroll into. If you're on the wait list by signing up for the Fitness Pain-Free Mini Course, I'll alert you when that next enrollment period is open and you can get started. Let's get back to the show now. So what is chronic ankle instability? It is persistent pain, swelling, and or giving way, so some sort of instability, and or recurrent sprains for at least 1 year after initial injury. It's going to lead to long-term absenteeism from work and sports. It has a large socioeconomic burden. Okay, it's expensive. Folks that roll their ankles have a good chance of having chronic ankle instability and become expensive folks for that reason. It's also associated with osteochondral lesions and joint degeneration. So if you end up with an ankle sprain, 50-50 shot of getting chronic ankle instability, and you may end up with more osteoarthritis and disability over the course of time for that reason. This is why an accurate diagnosis, treatment, and prevention could reduce some of this socioeconomic burden and keep people fit, active, and healthy. We should probably take these injuries a little bit more seriously than we currently do. What is the prognosis or natural history of lateral ankle sprains? So, largely, these get better very quickly. So, within the first 2 weeks, pain rapidly resolves in the large majority of individuals. And these stats are kind of crazy to me. The average time to return to sport after lateral ankle sprain is 16 to 24 days. If you look at NCAA athletes, in 44% of the lateral ankle sprains, athletes return to play in less than 24 hours. So half of folks are getting back to sport right away within 24 hours. In 3.6%, the athlete required more than 21 days before returning to play. So around 96% of folks are getting back before 3 weeks. Okay. And that's a good thing. So largely folks get back relatively quickly and it doesn't take too long. A few people take 3 weeks or more, but not that many. I know I'm harping on this like crazy, but up to 40% of these injuries become chronic ankle instability or recurrent sprains. And here are some kind of interesting stats I picked up. So at 3 months follow up, let's say you have a lateral ankle sprain and they're looking at your ankle 3 months after the injury. 65% of participants reported instability. 24% reported one or more resprains. At 12-month follow-up, 55% still reported that same instability, and greater than 50% regarded themselves as not completely recovered. At the 1 to 4 year follow-up, 5 to 46% of patients still experience some sort of pain. 3 to 34% of patients experience recurrent sprains. They had another ankle sprain. And 33 to 55% of patients reported instability. At the 2.5 to 5 year follow up, clinical symptoms of anterior ankle impingement were present in 25% of all athletes. So, what does that mean? So, largely, when these athletes try to dorsiflex their ankle, they'll have some sort of painful pinching or restricted range of motion in the front of the ankle. Can't tell you how many athletes I've worked with that sprain their ankle at some point in the past, and now they feel kind of blocked in the front of the ankle, kind of painful, pinchy sensation in the front portion of their ankle. Okay. There was radiologically confirmed tibio-talar osteophyte bone formation in 82% of these athletes. So, after you have a lateral ankle sprain over the course of time, this leads to a sequelae of events where your body starts to form some bone in the front portion of the ankle. And this leads to those symptoms of anterior ankle impingement. Okay. Now, it makes sense if we can reduce some of this by doing a really good rehab program, we should. But our research isn't robust enough to tell us if we do rehab after someone has ankle sprain, if we'll actually reduce some of these issues in the future. So, what are some predisposing risk factors for lateral ankle sprain? If you look at the intrinsic risk factors, being a female increases your risk of lateral ankle sprain. Having limited ankle dorsiflexion range of motion does as well. Reduced proprioception. So if you score poorly on a star excursion balance test or other form of balance test, that may predispose you to more lateral ankle sprains. If you have deficiencies in postural balance and control, so same thing. If you have trouble with single-legged balance, that could be a problem. Things that may affect your wrist are high medial plantar pressures during running. If you have either high or low BMI, this may increase your risk. And some additional factors that may contribute to increased risk are reduced strength, reduced coordination, poor cardiorespiratory endurance, limited overall ankle joint range of motion, and decreased peroneal reaction time. So we have some interesting research to show that if you roll your ankle, that could potentially cause some nerve injury, which will now delay firing of the peroneals. And when you try to land well in the future as an athlete, you may not be able to fire the peroneals quickly. That might increase your risk of having future ankle sprain injuries. Some intrinsic risk factors are the sport that you play. So if you play aeroball, and I had no idea what this sport was previously, but largely it's a trampoline sport. So obviously it's a lot of jumping and landing. If you play basketball, indoor volleyball, field sports, or climbing, your risk of lateral ankle sprains is higher. You also will have a higher risk with soccer. And if you play on grass, you're more likely to have an ankle sprain than playing on turf. So I played soccer in high school, and I often played on really poor fields. And if it was a bad field, if you step in a hole, you might roll your ankle. So that makes sense. So, position is probably going to be a player in whether or not you get an ankle sprain injury, with defenders and soccers having more injuries than other position players. So, what are the prognostic risk factors for developing chronic ankle instability? We just went over the risk factors for having a lateral ankle sprain injury. Can we identify the folks who are going to go on to have chronic ankle instability? And here are some prognostic factors that were identified in these studies: an inability to complete jumping and landing within 2 weeks after a first time LAS, which makes sense. If you have a worse injury, maybe that increases your risk of chronic ankle instability. If you have deficiencies in dynamic postural control, increase your risk. Altered hip joint kinematics. So if you're jumping and landing and having poor control at those joints, could be a problem. Having a lack of mechanically stability / increased ligament laxity 8 weeks after an ankle sprain. So having an anterior drawer that's more positive after an injury, 8 weeks after the injury, increase your risk. Sports participation at a high level. So if you're an elite athlete, that may expose you to more risk of injury compared to a recreational athlete. Being a young male increases your risk. Having increased BMI increases your risk. Having greater body height, so those bigger, taller people are more likely to get CAI. Persistent postural imbalances, which is largely balance over the course of time. And also having high workloads after initial injury. So let's say you get injured in the middle of a season and you have a whole bunch of games coming up, more than usual. That may actually increase your risk of developing chronic ankle instability, probably because you're not allowing time for this to heal and doing a solid rehab program. You're just playing your sport at a high level like you normally would, right? If you guys are enjoying this evidence based guide, I have another one for you. It is the evidence based guide to patellofemoral pain syndrome. So I'm going to leave a link in the show notes. I'm also going to leave a link up in the corner. So go ahead and click on that link if you want to continue with the learning. If you guys are interested in the references, I do recommend you check those out. I will leave them as a link in the show notes and you can get to reading them. Lastly, I just want to say thank you. Thank you so much for your support. You truly allow me to do what I love for a living. If you're on YouTube, smash that thumbs up button, leave a comment. I love to hear your thoughts on this presentation and consider subscribing. It helps me out a ton. If you are listening to the podcast version of this, please consider leaving a positive rating and review. Helps me out tremendously. And lastly, if you want to go that last extra step in supporting me, please consider subscribing to Fitness Pain-Free Insiders. All you have to do is head to fitnesspainfree.com, click on the programs link, click on Fitness Pain-Free Insiders online library. Just $1 for a week-long trial, and you get more great learning from me. I'll leave a link in the show notes as well, so you can check that out pretty easily. Thank you guys for watching. I'll see you on the next one.